Hi, I'm Elizabeth Flint, and this is eYoga Healthy Living. I'm actually almost 40 weeks pregnant, and in preparation for labor and birth, and also to help things get moving along, I've created a yoga practice that you can do in late pregnancy. So yoga in general is great for pregnancy, and prenatal yoga is even better because it focuses on the needs of a pregnant woman. But I noticed for myself, I went to a prenatal yoga class recently, and in the last couple of weeks of pregnancy, even a prenatal class can be a little bit too fast, and the movements can be a little bit too intense when you're getting so close to going into labor. So this practice is designed for those of you that are really close to the end of your pregnancy, to help you not only feel good in your body for those last few weeks, but to get your body ready for the birth and labor process. So if you have a strap, it's great. We're going to use one. If you don't, you can grab just a belt or scarf or something that you can use easily. I'm going to stand with the feet a bit wider than the hips, and then stretch your arms out a little bit wider than your shoulders, holding your strap or your scarf in your arms. And reach up overhead to start elongating the sides of the waist. And then as you exhale, take that strap back behind you. So give yourself as much strap as you need in order to go all the way back without bending your elbows. And as you inhale, draw the strap back up overhead. And as you exhale, bring it down in front of you. Inhale, pull the strap up, and exhale, the strap back and down. Inhale, drawing the strap up, and exhale, the strap forward and down. And we'll continue a few more times with your breath. It's important that we open up the shoulders and the chest so that we release tension in that area of the body. When we go into labor, a lot of times we tighten up, especially when we're feeling strong sensation in the body during contractions. So whatever we can do to help open up the lungs, open up the chest, open up the shoulders will be really helpful in getting through that process more easily. You do this, on your own. You can do it about 10 times back and forth until you feel the shoulders starting to warm up, and that you're connecting your movements with your breath. And do it one more time, inhaling on the way up and exhaling as I come back down. And then for now, I'll just set the strap over to the side. So I like to start from standing and move into some standing poses and then get down to the floor. I don't want to get up and down with this big belly that I'm working with. It's harder to do that. So start by stepping the feet out even wider. If you stretch your arms out, your feet should be about as far apart as your hands. And then you can bring your hands back to your hips, pick up your right heel and turn the toes out to the right side so that your toes and heel are in line with the arch of the opposite foot. And again, to create more space in the spine, we're going to hook the thumbs, reach up as you inhale, and then as you exhale, bend your right knee over the ankle and open your arms out wide. So as we have more weight in the pelvis and in the belly, we want to be gentle on the knees because they're also more relaxed with the hormone relaxin that makes the joints more open for birth. So I suggest that keeping the knee slightly further back than the ankle, so that you don't overstretch that knee joint. So we'll inhale the arms up again, and then exhale, bend the knee, opening wide, reaching the arms out wide into Warrior Two. So I'm going to keep the right knee bent as much as it feels comfortable and press down into the right heel, and then move my arms through a few movements as I keep strengthening the legs. Turning the right palm up, inhale, reach up and back into Reverse Warrior. And as I exhale, place the right hand on the thigh, just lightly, and then inhale the left arm alongside the left ear to stretch the left side open. Exhale the left hand down the left leg. Inhale the right arm up alongside the right ear. Exhale the right hand onto the right leg. And inhale the left arm up alongside the left ear. One more time, exhaling the left hand down. Inhaling the right arm alongside the right ear. Exhale the right hand to the thigh. Inhale the left arm alongside the left ear. Exhaling back to Warrior Two. Arms open wide. Deep breath in and out. And then hands can come to the hips. Straighten that right leg and turn the toes in. Pick up the left heel, pivot, turn the left toes out to the side so that your toes and knee are in line with the arch of your back foot. That way when you bend the knee joint will be safe. Then we'll hook the thumbs, reach the arms up, elongating the sides of the body, and as you open the arms wide, bend that left knee. Again, we're not going to go past the ankle. We might even bend it just a little bit less to support the knee joint. And we'll keep the legs in Warrior Two here, strengthening the legs, getting ready for that labor. And turn your left palm up, inhaling into Reverse Warrior. Exhale the left hand onto the thigh. Inhale the right arm alongside the right ear. And exhale the hand back down. Inhale the left arm up. And exhale the left hand to the thigh. Inhale the right arm over. And exhale back. One more time. Inhaling to reverse. And exhaling the hand down. Inhaling into side angle stretch. And exhaling back down. Then arms open wide, Warrior Two. One more deep breath in and out. And then hands will come to the hips, gently straightening the left leg and turning the toes in. Now I'm going to set my feet together for a moment, just give my pelvis a break as the tendons and ligaments in the pelvis and the joints itself are opening up. We do want to stretch, but we also want to let it settle. We don't want to overdo it. So come back to my arms and shoulders for a moment. I'm going to take the strap over one shoulder, reaching my right arm up, bend the elbow and find the strap with my right hand. My left arm out, turn that palm back and slide my hand up, finding the strap. So I'm just holding the strap behind my back in both hands so I can get a nice stretch through the shoulders. And I'll step my feet out wide again and turn the toes out to 45 degrees so they're pointing towards the corners of my mat. And then as I bend my knees again, I don't want to go past the ankles. I'm just going to bend the knees to get the hips open and strengthen the legs. Taking a few deep breaths here as I open the chest, inhale and exhale. Opening up the shoulders, inhale and exhale. And strengthening the legs, inhale and exhale. And then as I inhale, straighten the legs again, turn the toes in, release the strap, let my arms come down, whoop, and then take the strap over onto the other shoulder. Now I'll reach my left arm up, bending the elbow, and find the strap behind the back. Right arm out, turn the palm back, and then swoop that hand up, reaching the hands as close together as you can while keeping your collarbones broad and your chest open. Then you turn the toes out to 45 degrees again, not all the way out to the sides because that will take you out of balance, but just enough that you can open up your inner thighs and bend the knees over the ankle. And as I hold this, I'm kind of moving up and down just a little bit, allowing for that wave of breath. I come up a little bit on the inhale and then sit a little bit lower on the exhale. Strengthening the legs, but also relaxing the pelvic floor muscles. Those muscles need to relax and spread as we give birth. And the body has its own natural wisdom to do this. It's really our job to relax and let it happen. One more deep breath in and out. And then inhaling, the legs straight, and exhaling the toes in. I'll release my arms, and we'll do one more stretch with the strap. So I've made the strap into a loop that's about as wide as my shoulders. I'm going to take my wrists into the strap behind my back so that it creates a bind, and stretch the fingers out wide, stepping the legs out one more time. Pull on the strap, lift the chest up, look up, inhale. Again, if you don't have a yoga strap, you can just hold on to your scarf with your hands instead. This just gives you a little bit more opening in your palms. And then as I exhale, I start to fold over the legs, Slowly, as far as I feel comfortable. You might not want to go all the way down, depending on how you're feeling, but this is a nice shoulder opener and a nice opener for the backs of the legs. So rather than trying to reach the arms overhead, I'm going up towards the ceiling with my fingers and broadening across the chest, pressing down into the feet and lifting up through the thighs. One more deep breath in and out. And then pressing the strap apart with the wrists, lift the head, come all the way up slowly. And release the hands from the strap. Step the feet back together. Relax. Deep breath. So now we're going to move over and I like to use my bed in the morning as a prop to help me do the poses that I might normally do on the floor. But as we get this late in pregnancy, it's a little easier to do them with the bed. So you can move your mat over. We'll start in a modified version of downward dog. So you'll take the hands, shoulders distance apart, onto your bed and walk your feet back until your arms are straight, in line with your ears, and your heels are right underneath your hips. So you get a good stretch for the backs of the legs, without getting heartburn or feeling like the weight of the baby is pressing down onto your lungs and onto your stomach. You take about 5 deep breaths here, stretching into the back body, pressing your hands down into the bed. And the neck is just relaxed, not trying to pull up or down, staying right in the center. And then we'll lift the head, slide the hands just to the edge of the bed, and step the right foot forward. So I can press back more into my left heel. For me at least, my calf muscles get really tight. I think the extra weight of the baby, trying to walk around and, walk the baby down, that the calf muscles in the feet and ankles get really tight. So this is a good stretch to send the blood flow back down to the lower legs, to open up the calves and open up the feet. So we just kind of press the hands into the bed, press the heel into the floor, and keep your other knee bent over the ankle. There's very little weight in my front foot. And then I'm going to switch my feet, stepping the right foot back and the left foot forward, left knee over the ankle, pressing into the right heel. You can lift your chest. If you're having any issues with your wrists like I am, where they start to hurt because of the extra fluid, you can make fists and press your fists into the bed, keeping your arms and your wrists straight. And that will take the pressure off of your wrists as you do this. And then stepping the feet together about halfway. And bring the hands to the hips and step the right foot up onto the bed. So a lot of the lunges that we do in our regular yoga practice, at least for me, and the pelvis is getting heavier and more weight bearing down, that has become uncomfortable. So if you put your foot up higher, then there'll be less weight there and it's a little easier to move in and out of the poses. So as you can bring your right foot onto the bed, a little bit wider than your own hips, and then just bend into the knee until you feel you've gone far enough for your body. And reach your arms up, hooking the thumbs, interlacing the fingers, getting a stretch on the inner thigh of your right leg and on the front of your left thigh. Lifting the chest and opening. Keep pressing down through that heel that's on the floor and into the foot that's on your bed. Wrap your arms in and reach up and out through your fingers. And then release your hands down onto the bed again. Flat hands, or make your fists and lean in a little bit more towards the bed to deepen the stretch on the front of the left thigh and the inner right thigh. So a lot of squatting positions are really helpful when we're in labor, and also to help in that process of birthing the baby, getting the pelvis open, So this is a great pose to do. You can even do this when you're in labor. And then we'll step the right foot back to where the left foot is, and the left foot up to the outside of the hands. Again, just a little bit wider than your hips. Hands on the hips, and then switch the hook of your thumbs. Reach up, lean in a little bit, bending into the left knee, pressing down into the right heel. Lifting the chest and opening up. So there's a bit of a back bend, a sense of doing a back bend here. Arms wrap in and fingers spread out nice and wide. You open up the front of the body. Deep breaths. And then hands back down onto the bed, flat or making fists, and slide in a little bit further. Let your right hip sink forward a little bit more. Let the left knee bend slightly. Roll your shoulders back and lift your chest. And I said you can do this during labor. During labor you might move around a little bit more. You know, any kind of soft, gentle movement will help soothe discomfort in the body and help calm your nervous system as you're working with contractions. And then you can step your left foot down, bring the hands back to the hips, stand up tall. We'll just do a little bit of movement with the pelvis. One of my friends who is a belly dancer told me that belly dancing was originated by women who are pregnant to help them with the labor and birthing process. So I'm in no way an expert, but just the movements of the hips in a circular motion can be really helpful to unlock tension and to start that action, getting the baby ready for the birth. So the baby is actually in charge of initiating labor. Sometimes we think it's the doctor, but really, in a natural birth, the baby initiates either the breaking of the water or the beginning of the contractions. So what we're doing is just kind of encouraging her along, like this is a safe space to do this. The body is ready for you to do this. And these movements with the hips are helpful. And when the baby does start to descend out of the pelvis, it's actually a spiraling motion that brings the baby down and out. So this kind of facilitates that spiraling motion. You can do this as much as you want. I usually do about 10 or 12 circles in one direction and then 10 or 12 in the other direction. And when you're in labor, you can do this with your hands down as well. You can kind of move around in bigger circles, or even with your elbows down. If you're having back labor, you can have your partner or your doula press into your outer hips from the lower back here, not on your spine, but on your outer hips and your pelvis to help relieve that pressure as you're moving in your pelvis. And then for now, we'll do one more stretch here with the bed. So pigeon pose, one of my favorite yoga poses. I realized about 30 weeks of pregnancy, I couldn't do it anymore on the floor. So I started doing it on the bed. So I'll take my right foot up onto the bed in line with the left leg, and then bring the right shin onto the bed. Flexing the right foot to protect the knee. Again, our joints are looser, so we don't want to force them. I'm going to be pretty conservative with the stretch, but I can wiggle my left foot back a little bit to make the stretch deeper on the front of the left leg. And then fingertips on the bed, pressing back, opening up the chest. So we open up the right outer hip, the front of the left thigh. If you're feeling really stable, like you don't need to hold on to the bed, then you can try hooking your thumbs behind your back, really opening up the front of the body. Ekapada Raja Kapotasana, one-legged royal pigeon pose. And then release your hands. Be gentle as you come out of the pose. You might even use your hand to bring your foot down. And switch sides. One hip may be a lot tighter than the other. This is a good stretch to do if you're having sciatica, which comes and goes for a lot of us during pregnancy. But just be gentle again with your knee. Make sure you're flexing the foot of the bent knee and use the bed as much as you need to support your weight. If your hip is tighter, you might press down more into your hands to come up higher. If you're feeling more open, you can wiggle your right foot back a little bit more, deepen that stretch. And then if you're feeling sturdy and your knee isn't having any pain, reach behind your back, hook the thumbs, roll the shoulders back and open up your chest. Remember your breath. Your breath will be your best ally during labor and birth, just as it is in your yoga practice. And then as you release, come out slowly. Hands to the hips, standing up. And now we'll make our way down onto the floor. So you're certainly welcome to incorporate the regular downward dog and some other poses if you're still feeling up to it. But with my swollen wrists and acid reflux, I've decided it's time for me to let that one go, at least for the next few weeks until baby comes. So you can come to sit on the floor. If you have yoga blankets, go ahead and sit up on one. If you don't, you can use a pillow from your bed. And we can't really fold forward too much, so side stretches are better. So for this stretch, bend your right knee, draw the heel in just in front of the pelvic floor, stretch your left leg out to the side. And then you can walk your left hand down either on the leg or outside of the leg, opening up your right side. It's a little bit of an open twist. And then reaching your right arm up and over. So we'll find that side stretch as we open up the inner thigh of the right leg and the inner thigh and back of the left leg. Keep lifting up your chest, reaching through your right fingers and breathing. If you feel too much compression, then you can always sit up a little bit more. Whatever feels good for you at this point. And we'll come back up and switch the legs. Bringing the left heel in, stretch the right leg out. Slide your right fingers either down the shin or outside of the shin. Open up your chest towards your bent knee and then reach that left arm up and over. Out past your right toes, opening up the side of your waist and lifting your chest. Breathe into the sensation. One of my friends said she imagined her contractions as if she was standing in the ocean and just letting the waves kind of move over her. So rather than trying to do anything, to fight against it, to push through it, our best way of approaching the intensity of labor is by surrendering. Surrendering as much as possible. And that is one of the main components of yoga practice as well. And then as you come up, you can bring the bottoms of the feet together. Probably not folding over much, but maybe walking the hands out a little way. You feel any kind of compression, then that's far enough. And breathing down into the hips. And they say that open mouth, open pelvic floor. So when you inhale, you can think of making space. And as you exhale, open the mouth and let the pelvic floor open as well. Inhaling to create space, and exhaling to open up the pelvic floor. And then we'll finish up with just a few things that you can do during labor. As a yoga teacher, I thought I'd be doing tons of yoga moves during my first labor and delivery, but in reality, it was a lot of lying on your side and kind of walking around the house until the time was right. But towards the end, there are a few poses that were actually really helpful in that labor and delivery process. So one is just our basic squat, which you have probably done before. You can put your heels on the edge of a blanket and turn your toes out a little bit. If your knee joints are bothering you at all, then I would suggest sitting up on a stool, or you can use yoga blocks. Otherwise, let the pelvis descend down. Bring the elbows to the inner knees and your hands into prayer. And you can stay in this position still, or you can kind of rock from side to side. Movement just, again, helps soothe us, so we don't have to try to hold perfectly still. We can let that sensation move through us and let the energy move through with a little bit of movement. So you can do this to practice before you go into labor, and you can do this during labor. You can also do it squatting down and turn towards the bed, put your hands on the bed, or you can have your partner hold your hands and you can hold on and just let your head come down like this. I would have my partner do it, but he's filming me right now. And then the next one can be a good birthing position for some people. Your midwife, your doula, maybe even your doctor would help you get into this position if it's necessary for your birth. You can come down onto your elbows and your knees wider than your hips, and you're just rocking back and forth. Again, breathing in and opening the mouth to breathe out. The pelvic floor is very open in this position, and it's a rocking motion will help the baby move in the direction that needs to go. And one more position that some people use is, again, like the squatting position I did on the bed. I find it to be a little bit difficult at this point, but during labor, you're not going to be feeling slight discomfort in your body. You're going to be kind of in that zone like you would be if you're running a marathon. So you can step your foot forward outside of your hands and do a squatting position like this, coming back and forth on your wrists or on your hands. And one of my teachers actually gave birth in this position. So again, the pelvic floor is very open, and that movement will help soothe and get things moving in the right direction. So you can do that. Doesn't really matter which leg you use. At the moment, you'll just pick the one that feels more natural to you. But when you're practicing, do both legs. And then for me, in these last couple of weeks, finishing up with Shavasana. Obviously lying on your back on the floor is not so comfortable. So I'm doing a legs up the bed variation. So if you have some yoga blankets and blocks, that's great. If you don't, you can do this with a wedge pillow or just a bunch of couch cushions. Create an incline for your upper body. I'm using yoga blocks, one on the medium height, one on the high height, pretty far from the bed because I want to have a lot of room for my belly. I'm going to come sit in front of the blocks. Lie back slowly. Legs up onto the edge of the bed. And I'll just stay here until the baby's ready to come. This helps to reduce swelling in the ankles and feet, to send the blood flow back to the pelvis, back to the heart. And it's calming to the nervous system. You can stay here for 5-10 minutes, however long you feel comfortable. And when you're ready to come out, keep your head back and just use your hands to help bring your feet down. Shift over slowly to your left side. And just take a moment when you finish to remember that the labor and birth process is really something that you do together with your baby. So take a moment and close your eyes and connect to that miraculous life that is inside of you, that started inside of you, and that is almost ready to come out and see the rest of the world. Namaste.